So my name's Nichole. I'm going to talk to you today about vestibular rehabilitation therapy. I graduated from the University of Tennessee in 2002 at the Health Science Center with my Master of Physical Therapy, and I started treating patients with vestibular dysfunction in 2010 after I received my training in that. I'm originally from Houston County, and I moved here last year to Henry County. Like Steve said, I've been working for the Center for Wellness and Rehab for 5 years. So today we're going to be talking about the vestibular system, and that system is the system that primarily is related to your balance. It helps you perceive motion and gravitational changes. It helps you maintain an upright position, basically. It also helps you control your eye movement, and any dysfunction in the system can lead to dizziness. The vestibular organs are located in your inner ear, and they provide information to your brain along with your muscles to help control your balance and avoid falls. So this is just a diagram of your ear. So the first part, so your outer ear there, which is basically just kind of a protection for your middle ear that contains your eardrum. That is responsible for accepting sound waves. The middle ear then goes to the inner ear there, and that's kind of what we're talking about today, is specifically the inner ear. So today we're going to be talking about benign paroxysmal positioning vertigo, which is a really long term, so we'll probably just call it BPPV for the most of the treatment. For the most of the session here today. We're going to talk about vestibular hypofunction, Meniere's disease, and we'll also talk a little bit about strokes, multiple sclerosis, cervical dysfunction, and orthostatic hypotension. And all of those things are diagnoses that can cause dizziness. So why do we treat dizziness? Dizziness is the number 3 reason individuals over the age of 65 go to the doctor. And it's the number 1 reason over the age of 70. So it's a very big issue that we look at. Most of the time it's medicine is not needed and surgery is not needed. Most of the time it's other issues that we can take care of without that. 50% of the individuals over 65 with dizziness will develop BPPV that I was just talking about. And the really great thing about that is that oftentimes it can be cured with 1 simple visit of physical therapy. So the problems with dizziness, generally people who experience dizziness will decrease their activity level because they don't want to fall moving around. So you'll get muscle weakness because you're not moving around as often. You'll start to get stiff and not as flexible. You'll start to lose your balance more because you're losing those small muscles in your feet and in your hips and knees that help you control your balance. And it can also lead to depression because you're not having as much social interaction. You're not going out, you're not driving, you're not shopping, those kinds of things. So whenever you come and see me, if you're coming for vestibular rehab, we'll go through and talk about what's going on when your symptoms started, kind of go through all that. And then we'll look at your cervical spine, we'll look at your neck, because your neck can cause dizziness. So we'll look at that, make sure that's not causing the dizziness, rule that out. Then we'll look at your eyes and see how your eyes are moving, because that tells us a lot about what is being affected in your inner ear. We'll do the BPPV assessment, which we'll go through, and I'll show you how we do that here in just a minute. We'll also check your balance. So we'll have you do several different little tests that assess your balance and see how it's functioning. I'll watch you walk and see if there's any problems along with poor balance, that there might be things that we can help you work with on that. And then we'll just go over just your strength and range of motion in general. So we'll talk about BPPV the most today because it's the most common cause of dizziness. So benign means it's not life-threatening. Paroxysmal meaning it comes and goes. It doesn't stay with you constantly throughout the day. It's just usually when you're moving. Positional meaning it doesn't happen when you're sitting still. It usually happens when you're moving. And the vertigo is the sense of spinning that you feel when it happens. Like I said earlier, it is the most common cause of dizziness. The interesting thing is 2/3 of cases resolve on their own. So a lot of you may have experienced it before and it went away and it didn't come back. But there is a 50% recurrence rate. And sometimes it can kind of linger and stick around and cause a lot of problems. So common symptoms include poor balance, of course that spinning sensation, difficulty walking, you get lightheaded at times, you have sometimes nausea and vomiting, and sometimes that can be pretty severe for some patients. You might just have a sense that you're tilted, kind of like you haven't had your V8. Some people feel like that sometimes. Or your vision feels like it's blurry or jumping. Most people tell me that they experience the symptoms when they roll over in bed at night or when they get up in the morning, when they bend over to get something out of the floor, or when they're reaching up overhead getting dishes out of the cabinet, or, like I said, screwing a light bulb in here. And we're going to pull it over here. So these little guys right here are called otoconia, or the ear rocks that you've heard of before, or ear crystals. And they're supposed to be sitting in that spot right there that it's showing. So, get my pointer to work again. So right there, they're supposed to be right there. If they float out of that area and get into any of these 3 canals right here that are highlighted in blue, then you're going to experience the dizziness. There's just fluid in those canals, so when those rocks get in there, whenever you move, it swishes the fluid around and those rocks move, and until you stop that movement, they settle down, and then that dizziness will go away. So a lot of people ask me, what are those ear rocks made out of? It's just a calcium carbonate. It's very similar to limestone, but they're very, very tiny. They're microns tiny, so you can't see it with your naked eye. You'd have to have a microscope to actually see these. Issues that can cause BPPV. We see it a lot in people who have had a fall or had an accident where they've hit their head. An interesting thing, people with migraines are 3 times more likely to experience BPPV. And not exactly sure why that is, just an interesting fact. Genetics can play a role, as well as sleeping position or prolonged immobility. So I've seen patients that, one of the most interesting patients I had been to the dentist, and whenever he got up out of the dental chair, they thought he had a stroke. Sent him to the emergency room, cleared everything out, and it ended up being BPPV. So how we diagnose BPPV, we do 2 different specific tests. We've got the Nichole pipe test and the roll test. And the issue with doing the test, especially with those people who have a lot of nausea and vomiting, is that it puts you in that very specific position that you don't like to be in, that makes you not feel good. So we try to discourage you using like the meclizine or the antihistamines, the Dramamine when you come in, so I can see what's going on. But if you do have Phenergan or something that you're taking to decrease the nausea in your stomach, that's okay. You can do that. So what we're looking for when we do those tests it's called nystagmus. And nystagmus it's an involuntary movement of your eye. And basically what your eyes do when you lay down, they will twitch a certain way together. And it's really interesting to see. If you've ever taken somebody and you spin them around on a merry-go-round and you stop them and you watch their eyes, that's what nystagmus is. And that's what happens to people who have BPPV when we do this test. In the treatment, they're called canalith repositioning maneuvers. And there's several of those different maneuvers. I'm going to go through a couple of them today. Not all of them, because I don't want to bore you to death. But they are 80% effective at treating BPPV on the first visit. So it's pretty cool. So I'm going to go through those right now. I'm going to ask my trusty assistant to come down and help me. So the first thing I'm going to show you is the Nichole pipe test. So this test for the specific BPPV. So what I'll have Sky do is she's going to turn her legs around facing that way. I'm not going to scoop up this way a little bit. Okay. So what we're going to do, we're going to say we're testing the right side. So we're going to turn to the right side about 45 degrees, and she's going to extend her head just like this. And I will tell her on the count of 3, we're going to lay down very fast, and you might feel dizzy or sick, but I want you to keep your eyes open because I have to see what's going on. So on the count of 3, we'll lay down very quickly. 1, 2, and 3. And then I just watch, very up close and personal. And we'll hold this position for about 30 seconds because sometimes it can take a little bit for the crystals to float where they're going to make the response occur. And if I don't see anything, or if I do see anything, I'm going to still go ahead and go into the roll test. So the roll test, we just come into a little bit of flexion. We're testing a different canal here. Hold, and then we're going to turn quickly to the left. Now look, hold that for about 30 seconds. And then we'll turn back and check the right again. Here. Okay. And then she'll sit back up. And I always have to keep my hand on the patient because usually when you come back up, you're going to feel a little bit woozy as well. So that's the test. That's very, very simple. We would sit and wait for 30 seconds and then test the other side. So if it was positive, if I saw what I was wanting to see with that, then we would go through and do what's called the Epley maneuver. So with the Epley maneuver, you go back into the same position. So, okay. We're going to come down quickly on the count of 3. 1, 2, and 3. Stay here until the symptoms go away or for at least 30 seconds. And then she's going to turn her head to the left. And we'll wait 30 seconds there or for symptoms to go away. And then you can uncross your arms. You're going to keep your head turned to the left and roll to your left, looking down at the ground. Just roll. And just roll. And tuck your chin. Here. This is usually where the symptoms come back, but I stay with you through the whole treatment. And then you can let your legs off. And then sit back up. And that's it. That's the treatment. Pretty simple, huh? That's amazing. Okay, and so that was for 2 different kinds of BPPV that I just showed you. There are other kinds, if the crystals get in different canals, there's a little bit different treatment maneuvers that you would do. But that's just a good example of what we do. It's just a movement of your head and rolling and trying to get those crystals back out of those canals back to where they're supposed to be. So, like I said, most of the time it's resolved within the first treatment. But what if it's not? It's not always resolved in the first treatment. So at that point in time, I would give you a home exercise program to do. And you would basically do that exercise at home 3 times a day. And then you would come back and see me, and hopefully the next visit it's taken care of. So the other diagnoses that I wanted to kind of go over, that when it's not BPPV, that it could be, we've got the vestibular hypofunction, Meniere's disease, cervicogenic dizziness, multiple sclerosis, stroke patients, and patients with orthostatic hypotension. So the vestibular hypofunction, and I even had one person come in today to talk to me about that they had a virus in their inner ear. So if you get a virus in your inner ear, it can cause dizziness. They're called vestibular neuronitis or labyrinthitis. Those usually only last for a few days, usually 3 to 5 days, but it can be very severe and very debilitating. You can have some residual dizziness left over after those go away. So that's something that you can come in, we can help you with. We can work on those specific activities that are still making you dizzy to try to help you get back to your normal function. Meniere's disease. Does anybody in here have Meniere's? No? Good. That's good. Meniere's disease is something that you have dizziness, like with the BPPV, it just kind of comes and goes every now and then when you move. With Meniere's disease, you have episodes that can last a few hours to a few days of constant dizziness, where you've heard people that just cannot get up out of bed because they're so dizzy, or they can't even walk down the hall because they're bouncing off the walls. That's Meniere's disease, and it usually is caused by excess pressure and buildup on the inner ear, and there's certain triggers that can happen with that. It causes nausea, severe spinning, hearing loss, and then a lot of pressure in the ears. And so what we do, after you've been to an ear, nose, and throat specialist and been diagnosed with that, we talk about your diet, what kind of things you're eating, making sure that you're doing the right things that aren't causing that to reoccur. The doctor will put you on different medications to help you through the episodes when you have them. We can set you up with different assistive devices that you need to help you be safe in your home when the episodes occur. And then we can also, you come in to see us, not during the episodes, because we can't really make those episodes go away with physical therapy, but we can help you cope with them a little bit better in between. Cervical dizziness. So people who have degenerative changes in their neck can experience dizziness. And it's not as common, but it does happen. We typically see that in people who have had whiplash or some kind of neck trauma. If you have any severe arthritis or degenerative joint disease in your neck, or herniated discs. The symptoms with cervical dizziness, you usually have dizziness when you're sitting still. So you're just sitting there and you might be watching TV and all of a sudden you get dizzy. That is when we look at the neck for causing those issues. The treatment for this, we would work specifically on the neck. We would work on making sure that your posture is corrected, so you don't have the forward head. We're sitting up nice and tall. We want to strengthen your neck muscles and make sure that they're keeping you in a good position. And then we would work on any residual balance issues that you have related to that. Patients who have multiple sclerosis can benefit from vestibular therapy. They tend to have a lot of balance issues that go along with that. It can be a little more difficult to treat because a lot of types of multiple sclerosis are progressive, but certain types can have a really good benefit of coming in and working on very specific balance issues. Patients who have a stroke, generally we incorporate that into the stroke program because patients who have a stroke aren't usually just having dizziness. They're going to have some weakness, they're going to have some decreased range of motion, they're going to have difficulty walking. So we would do vestibular therapy with occupational therapy and speech therapy. The last one I was going to talk about is orthostatic hypotension. Does anybody have that you know of? So orthostatic hypotension is when you've been sitting for a little while and you go to stand up, you get that big head rush. So what we do for patients who have that, we make sure that we rule out that it's not caused by any medications, and you'll do this with your doctor. Make sure that it's not a cardiac issue. Patients who have diabetes and kidney failure are very commonly have this issue. You'll have fainting when you get up out of a chair, possibly, or even fainting when you get up out of bed. We can do exercises for physical therapy to help you aid in that, so it's not as severe. So basically, you would just do ankle pumps. You would do knee exercises before you got up, so you got your blood pumping before you get up to decrease the risk for falling. And we would also suggest that you wear some TED hose for the compression to keep your blood from pooling before you get up.